EHR Patient Portal, PatientForms. One of the benefits of implementing the Patient Portal is to provide intake forms for your patients, whether new or existing, so that they are able to complete all of the required paperwork prior to their visit. Now, these forms are 100% customizable based on your local needs and workflows. It can include anything from their patient's medical history, such as allergies, medications, surgery history, consent to treat, or any other specialty-specific questionnaires and forms relevant to your practice. The patient's workflow on the portal is the same whether they access it from their homes or from a kiosk within your clinic. Now, the data that they're entering into the portal is not actually part of the EHR chart until they have submitted it and you have accepted it. When there are multiple forms required, you can sequence them to ensure that the patient completes them all correctly by using the Submit and Next button, and this ensures that they don't skip any. Once the data has been submitted over to EHR from the portal, the only prerequisite is that the patient have a valid encounter in the EHR system, and then the users responsible for the patient intake do have to have the appropriate user permissions to approve patient forms. Once the form is accepted, it is then part of the encounter and therefore part of the progress note. So we're going to look at both parts of this process. So I'm going to log in here as my existing patient, Jessica Pearson, and we're going to go to the Patient Form menu. Now, when we get to the Patient Forms menu here, we see across the left-hand margin we have forms for the existing patients as well as new patients. So as we're looking now at our existing patient forms, we have chief complaint for this visit, follow-up questionnaire, consent to treat, and preclinic assessment. Now, of course, this is just in a sample in my training environment. You can have any number of forms here based on your specialty. If I go to the new patient forms, our menu's different. We have a new patient questionnaire, patient medical history. We still have a chief complaint for this visit, and then we have a financial responsibility policy. So you see how the form menus can change. Now, it's important to note that once the patient has submitted their form data to EHR, it is stored within EHR the same as the face sheet or input template data is. There's only the one set of data, regardless of if it comes from the portal or if the clinical staff enters it directly into the EHR. So I'm just going to go ahead and open up the patient history form here for Jessica. The content of the forms, of course, will vary based on the purpose. Just going to answer a few of the questions here. We're going to say Jessica's coming in today for abdominal pain and coughing. In this particular form, we do have medical history information. So we can go ahead and fill out that she is allergic to penicillin and what her reaction is. Let's say that she is currently on lisinopril due to high blood pressure. There's no significant past surgical history. Now, I'm not going to go through all of it. We'll say that she does have anemia. Since 2000, we'll say she was diagnosed. And then as we continue down, if see in this example, we do have the social history. We have our review of systems, which of course will be tailored for your needs. So we'll just go ahead and fill out that she denies all of her cardiovascular issues. But for respiratory, she is reporting her cough, her chest tightness, but she doesn't have amnesia. She does have shortness of breath. Now I'm just going to go ahead and submit it at this point. Now you'll notice my options across the bottom. I can submit one form at a time. If I have multiple forms that have been sequenced, if I click Submit and Next, that will submit this form and immediately display the next form to make sure the patient does not forget any. Upon submit, the patient does get this confirmation message that my submit was successful, and then it says that your data has been transmitted to your physician. At this point, the patient does have the ability of printing a copy if he or she would like, or just closing the window, which takes them back to the menu if they did not do Submit and Next, and then they could choose the next form. And that is all the patient has to do with regards to their paperwork. And again, they can do this at any time, from their homes or even on the time of their visit. If they don't have access to the internet at home, a lot of clients will set a kiosk up in the lobby. So now I'm going to log into the system as Connor, my medical assistant. Now, when it comes to completing the EHR part of the patient form from the portal, you have a couple of different options based upon your workflow and who does it. One option is to do it right here through the little icon on the home page. We see next to Jessica's name, there's a little form icon, and in her case it is showing as a bright red. Now when this icon is yellow, that means that there has been no data submitted yet for that patient. When it's green, that means that it has been completed and accepted into the chart and is now part of the encounter. This is the interim stage when it displays as red, meaning the patient has submitted the data, but nobody in the clinic has approved it yet or verified it. So one option in accepting the forms is through this icon. If you click the red icon, it's going to open up the forms that the patient has submitted. But if you notice across the bottom, in the case of Jessica, I do not have an accept button, and the reason for that is that Jessica has not yet been arrived. If we look back here on the home page, she's in a scheduled status. As mentioned on the beginning, a prerequisite is that the patient must have a valid encounter. So you do want to make sure you've arrived the patient first if you're going to do it through this icon. Now you could do that here through the mark arrived icon if that is your workflow, but we're going to look at the schedule next. And here on the schedule, if you look up here at Jessica Pearson, you'll notice the large capital P is in red, and that is to indicate that her paperwork has not yet been accepted into the encounter. Now you may not have these symbols displaying on your schedule if this is not part of your workflow. There's a property that governs that, and if it is part of your workflow where the front desk is responsible for verifying that all the paperwork is done, then at this point you could notice that it was not. Go ahead and mark your patient arrived and approve the patient forms. Now the third and most common way is to do it during the intake process from the encounter. So I'm logged in here again as Connor, the medical assistant, and we're just going to go ahead and open up Jessica's chart. The same forms that are available through the little icon on the home page are also here on the encounter screen, here along the left-hand margin under the option Patient Forms. So again, it would be your choice if you're going to do it through the icon on the home page or here at the encounter level during intake. And in the upper left, you will have a list of all the forms that the patient has completed with the little check mark. If the patient has not completed it, there will not be a check mark next to it. So in this case, we know the only one Jessica did is her history form. Now you'll notice at the bottom, I do have an accept button now. We did not have it before Jessica was arrived. Now that there is an active encounter, we can accept the data into the encounter, and we see all of the information that she submitted. So during the intake process now we have two choices. One, we can simply go ahead and accept it, which will make it part of the chart. And notice in the lower right, I do have my workflow arrows. Or I can go ahead and interview the patient and make changes if needed. Maybe she forgot to tell me that she has, oh, you know what, she also has a headache. She's also having palpitations. Or maybe something was wrong. She forgot a medication. So you do have the ability of updating it as well before you accept it. Now, if you do make changes, as I just did here, you do have to save them first, which is now going to append those into the same data that the patient submitted. My confirmation says save successful, and now I have to accept the form, which means approve, and now says encounter updated. Or you can accept the data and then change it in the respective pieces of the chart after the fact. So again, this is really going to vary on workflow as to when you want the data accepted into the chart and whether or not and when it is going to be verified and modified. So if I go now look at Jessica's face sheet, we see in green the information that is now updated. Of course, the yellow is coming forward since she's an existing patient. But remember, on the patient form, when we were logged into the portal as Jessica, we indicated that we had penicillins with shock and shortness of breath as the side effect and the rash. We didn't modify any of the other history elements there, except we did add the lisinopril to my medication. We also indicated chief complaints for this visit. So when I go to my HPI, notice all 4 HPI templates have been automatically added to my encounter. Now it's part of the intake, so the medical assistant can go ahead and complete the information. And if I just quickly show you the progress note, you'll see that all the information we entered on the portal as Jessica is reflected here on the note. You see her allergies, the review of systems, the HPI chief complaint templates, and so on. So you see that the way it works is the patient submits the data through the portal, the clinic accepts it into the encounter, and then it becomes part of the chart. So in review, patient forms allow your patients, whether they are new or existing, to complete all required intake details. This could include their medical histories, procedure consent, specialty-specific questionnaires, whatever's relevant in your office. The patient workflow is 100% customizable as far as the form content. Patients can submit them one at a time, or you can sequence multiple forms together so that they automatically flow and nothing is missed with regards to the patient's part. Once those forms come over to Prognosis EHR, the requirement is that there be a current encounter. The user must have appropriate permissions, and then the data has to be accepted in order for it to become part of the encounter and therefore part of the progress note.